Hello everyone, my name is Maharlika Diarse. I'm going to be doing intradermal injection administration. Before we start, I have my Nightingale scrub top, Nightingale scrub bottom, Nightingale badge, and my hair is pulled back. There's nothing in my nails, no jewelry. I have my supplies, my gloves, my medicine vial, tuberculin, my tuberculin safety syringe. I know it is open, but let's just pretend it is closed. This is just for the skills video and it's unused. Of course, in the real world, we're not going to use an open syringe. Alrighty, 2 alcohol pads and some gauze. And Miss Smith. Alrighty, I'm going to verify the 6 rights. Right patient, right drug, right dose, right time, right route, and right documentation. Alrighty, now that we have verified the 6 rights, I'm going to check the EHR order. The EHR order is a tuberculin test at 0.1 ml, and it is intradermal with 1 dose. Alrighty, and I'm going to wash my hands, and I'm going to take all my supplies with me. Knock on the door, pull the privacy curtain for HEPA, and I'm going to place these on a clean flat surface away from the patient, and I am going to wash my hands again. And now, hello Miss Smith, my name is Maharlika. I'm going to be your nurse today. Your provider ordered you a tuberculin test. It is intradermal injection administration into your forearm. And alrighty, so Miss Smith, can you please verify your name and date of birth? Going to verify her wristband, going to verify EHR, MAR, going to verify with the medication. Alright, I already identified that everything's correct. So now I'm going to ask Miss Smith, do you have any allergies to any medication or food? No. Already, Miss Smith, like I said, your provider has ordered you the tuberculin test, and it is the purpose is to see if you have any mycobacterium tuberculosis. And after this intradermal injection, 2 to 3 days after, you would have to come back, and a nurse would have to read your injection site to determine if you're positive or negative. Alrighty, and do you have any questions for me? No? Alright. Oh, you did any side effects? So some side effects are slight burning or swelling. It's going to be like a little mosquito bite. And some adverse effects would be lightheadedness and blistering. Now, if you do have any adverse effects, just please come back to the clinic and we will assist you, and I will let your provider know. All right, Miss Smith. So now I am going to wash my hands, and I will now put on some gloves. This had a cap, but since I was practicing, I'm going to pretend that there is a cap, and I will throw the cap away into the proper trash bin. And now I will open the new alcohol pad, throw it into the trash bin, and now I'm going to wipe the top of the tuberculin medicine vial. Throw it away. We're going to let that air dry. As we are letting that air dry, I have my new tuberculin syringe, safety syringe, and this is the 25 gauge at 5/8 of an inch. So I opened it. Pretend I opened it. So now I'm going to pick it up like a pencil, my thumb and my fingers. So now we are going to, while the cap is still on, we are going to withdraw 0.1 ml of air. So as we withdraw that 0.1 ml of air, I'm going to show you guys it is 0.1 ml. It won't show, it's focusing on me, but it is 0.1 ml of air. So I am going to place it back in here. So put it back in there. So now it is air dried already. So now I will pick it up like this and I will take off the cap. As I take off the cap, I am going to place it back into the wrapper. So place it back into the wrapper. I am going to place this straight down into the vial. Inject the air. As I inject the air, now I'm going to hold the medicine vial up and make sure that the needle is not bending. We don't want a bent needle going to our patient, and that is a safety concern. So now we are going to withdraw 0.1 ml of the tuberculin solution. So we are going to make sure that there is no air bubbles. There is no air bubbles at this time. So now we are going to tilt it back down, undo it from the bottle. So now we are going to do our 1 scoop method and holding it like a pencil, like so. And we are going to cap it back on. 1 scoop method. Perfect. One scoop method. I just want to make sure that it is capped on right. All right, it is capped. Sorry for the little confusion. Alrighty. So now we are going to locate Miss Smith's forearm. So this is Miss Smith's left forearm. We are going to pretend that her hand and her wrist are right here, and this is her elbow over here. So we are going to locate 3 to 4 fingers away from the antecubital space. So let's just pretend it's right here. So it will be in this area right here. So before we clean the area, I'm going to palpate and see if there is any skin discoloration, inspect, palpate if there's any mass or any tenderness. Miss Smith, do you have any tenderness over here? No, already. Everything looks good. So everything looks good. So now I am going to put an alcohol swab, throw this away. I'm going to swab it from inside and out, at least 2 inches away from the site. Alrighty, it is there. I'm going to throw this away. So as we are letting it air dry, waiting it for it to air dry, alright, it's almost dry. We are going to make sure that our tuberculin syringe, when we open it, we have to make sure that the bevel is up, and the bevel is up, and we are going to be at a 5 to 15 degree angle, and when we advance, it would be 3 millimeters inwards. Alrighty, so now I am going to take off the cap, place it in there, and I will make sure that the bevel is up. The bevel is up, holding it like so. Alrighty, Miss Smith, and I am going to just hold onto her skin, just stretch it a little bit. Alrighty, Miss Smith, I am going to do the tuberculin injection. It's gonna be some slight burning, and that's completely normal. Alrighty, here we go. I'm going to go 5 to 15 degrees in. The bevel is up. Alrighty, and we are going to advance, and we are going to inject slowly. We are going to inject. Alrighty, and it is mosquito-like. Alright, so we are good. We are now going to take out the needle. So now I'm going to discard this into the sharps container, usually a little thing right here. So sharps container, I'm pretending it is there. Alrighty, and this as well, dispose of it. Alrighty, and this we will pretend and dispose of it. Alright, Miss Smith, are you okay? So now I'm going to apply the gauze gently just to wipe off any like excess, either blood or the solution. All right, don't apply any pressure because we want to make sure that it is still a mosquito-like bump. Alrighty, we are going to throw this away, and if it is needed, we would put a bandage over just so that it's not exposed. Let's just pretend that this is a bandage. All right, Miss Smith, this is the bandage. All right. Okay, and now I am going to take off my gloves, dispose of it, to wash my hands. And now I am going to document my findings. All right, and that would be it. Thank you so much.